Okay, so for another assessment, so we'll be assessing patients' mental status. So usually, mental status involves just a bunch of things. Could involve patient's appearance, patient's cognitive ability, attention, um, memory, long-term, short-term memory, level of consciousness, patient's mood and affect. So for appearance, I see my patient. My patient looks well groomed. If the patient looks dirty, everything looks unkempt, then we have an issue actually going on. I also check patient's cognitive ability. Maybe like asking patient, okay, Mr. Teddy, can you tell me 100 divided by 4? I can say, okay, tell me what 8 times 8 means is, and patient tells me. I could also tell the patient, okay, spell some certain words backwards, maybe spell world backwards. And if the patient is able to do that, then I believe, yeah, patient has a really good cognitive ability. I'd also check for patients, attention. Attention to see how focused they are, and how well they concentration, how well they're concentrating like during the examination. I could also check for patient short-term memory, long-term memory, such as my short-term memory. I could say. Um, the bed's flying, and then after a couple of minutes I could ask the patient, what did I say, at this certain time, saying that the bed is flying. And if the patient repeats the same thing, that's a very good short-term memory. Or I could ask the patient, okay, how did you get to the hospital, things like that. This patient's actually how the patient came in. I could also ask for long-term memory, assess long-term memories by asking, tell me what your birthday is, what was the name of the president in, the last 5 presidents. I could ask them, when, when did you get married and things like that, just to access for long-term memory. When was your wedding? How can you tell me about your wedding? Things like that. And also checking the patient's level of consciousness. Make sure patient is awake, is aware of his or her surroundings. Maybe asking the patient, do you know where you are? Do you know what date it is? Do you know what day it is? Do you know what the president is? Like things like that, just to make sure. And also look at the patient's affect. Patient's demeanor, and kind of patient's reaction to stimuli, things like that. So, as long as patient is able to answer all those questions, patient's speech is clear, patient's behavior and his appearance, looks good. I think, in this case, I say that my patient is alert and oriented. Okay. So next, we're gonna go ahead with assessing the 12 cranial nerves. Okay, so the first cranial nerve is going to be the olfactory nerve. So in this case, we're going to be checking for smell in my patient. So here I have vanilla extract. So I'm going to have the patient close both eyes, and then we're going to test each nostril. Okay, so this actually smells nice, so it's better to use something that has a good fragrance, not something that smells really bad, because it could trigger a gag reflex. So we don't want that. So my patient closes eyes, and then I'm just going to close one nostril at a time and have patient inhale to smell and tell me what it is. And if the patient tells me it's vanilla extract, then that's good. That nostril is good, and we can check the next nostril, doing the same thing. Close the nose and perceive. And patient tells me the same thing, so we believe that the cranial nerve, olfactory nerve, is intact. So secondly, we're going to go to the second cranial nerve, which is the optic nerve. So we're going to be testing for confrontational visual field and visual acuity. Okay, so in this case, we're going to be testing for peripheral vision. In this case, I'm going to have my patient close his right eye while I close my right eye. I close my left eye, I'm sorry about that. And I'm just gonna move just like a hand distance, or just a hand away from my patient, So I'm gonna have him close his right eye, and I close my left eye, and I'm just gonna have him look straight into my right eye, okay? And then I'm gonna just test for peripheral vision, up and below, okay? And I'm gonna ask him to tell me how many fingers I have in the air, okay? Without looking at my fingers, just stay straight right into my right eye, okay? So how many fingers do I have? And the patient tells me, and I go down and ask what the patient is, put 3 fingers or 4 fingers in the air, and have the patient tell me how many fingers. Okay, and then we do the same thing. I close my right eye. Patient closes his left eye, and have the patient look straight into my left eye. And I do the same thing, put my 2 fingers in the air or 3 fingers. Ask patient how many fingers are in the air, and then down. I could put a couple more fingers and ask patient, how many fingers I have in the air. And if patient tells me, so we're good there. Okay, and then we're gonna go to checking for visual acuity. This is using the Snellen's chart. So in this case, I'm gonna have a patient stand 20 feet away from the chart, right? And then while I do that, I'm gonna ask the patient if the patient uses glasses. So if the patient uses glasses, the patient can put it on, and if he doesn't, then we can try the test. So what we're gonna do is just have the patient read the lowest level of the chart and read it out to me, and then we're gonna check both eyes by checking each one at a time. Okay, so I'm gonna have the patient, cover his right eye and read the lowest line. So I have the patient read that. After that, the patient's gonna do the same with the left eye. And if the patient's able to read like the lowest chart, it is usually an 8. I would grade the patient as a 20/20. Because the patient is able to read from a distance of 20 feet, as every other person can actually normally see at that distance. Okay, so that makes the cranial nerve, optic nerve intact. So with that test, the patient is actually doing good, 20/20. So yeah, that test is actually good. Okay, and your eyes are actually functioning well. Okay, so next we're gonna test the oculomotor nerve. We're going to test the trochlear nerve and the abducens nerve. So this is going to be like, we're going to be checking for like involuntary movements of the eyes, okay, which is also called nystagmus. So usually I'm just going to have the patient, have this. I'm just going to probably use my torchlight, just like 12 to 14 inches, okay? I'm gonna have the patient just away from his nose. I'm just gonna have just do the cardinal points, okay? I'm just gonna have the patient, follow the torchlight, okay? So we're gonna do this. Okay, and if the patient follows accordingly, without any involuntary shaking of the eyes, and that's it's actually working really good. Then secondly, we're gonna try dimming the lights. We're gonna turn the light off just to check for constriction, checking for constriction of the pupil. So what we're gonna do is I'm gonna dim the light and I turn it off. And then I'm gonna have the patient look straight up into an object, okay? And then once he's looking without any distraction, I'm just gonna, check to see, okay? And then I'm gonna do the same for the other eye. Have the patient keep looking straight and from the side, come in, and let's check for constriction. Usually if a patient is 3 millimeters, whose dilation, usually his normal dilation is 3 millimeters. When it's constricted, it be like maybe 1 millimeter. So it shows that the eye actually constricts and has response to light. Okay, and then secondly, we're gonna test for accommodation, and then we see if both sides are equal for before then. Okay, and then for accommodation, what I'm gonna do is to have the patient look straight up, into an object. Okay, and then I'm just gonna come in and just with a light, from without just with a light to see if there's any check for constriction in the patient's eyes, in a way of testing for the patient's accommodation, just for just to check to see if there's equal dilation in both sides. So this is what leads us to what we call pala, where we say the pupils are equal. The pupils are they're equal, they're reactive, equal reactive to light, and accommodation. Okay, all right, and that's where we get the word I'm sorry. They're equal, round, reactive to light, and accommodated. Okay, so that's done for our cranial nerve 3, 4, and 6. Okay, so when we go to the cranial nerve 5, which is the trigeminal nerve. So the trigeminal nerve is actually a nerve that helps with mastication. So usually we can ask the patient to clench his teeth. Okay, so when he does, I'm just gonna feel for the masseter muscle, which is just like a round ball on both sides, and then I'm also gonna go up and to feel for also the temporal muscle while patient does that. And if that feels normal, and then that's normal. And also we can also do the corneal reflex test, where I could, let's say, assuming this is a cotton wisp, I could just just apply it just on the lower or the lateral aspect of the cornea, just to see if the patient, just to check for any reflexes in the cornea. And if that works out, the patient's cornea reflex is also intact. Also, we can also test by having the patient, open his mouth and then apply some resistance, like and then press down to see, if the patient's able to, apply resistance against the the pressure I applied. Yes, so if the patient's able to open mouth with resistance, without resistance from me, then that also works. And so we can say the cranial nerve 5, trigeminal nerve, is actually intact. And so we can also, and then we're going to the intracranial nerve 7, which is the facial nerve. So in this case, I'll ask the patient to close his eyes tightly and then open them. I can ask him to frown. I can ask him to smile, pop out cheeks, just to check for that symmetry. Make sure it's both symmetrical, on both sides. Okay, and then we're going to test for the cranial nerve 8, the vestibulocochlear. So this is just pretty much performing like a whisper test in the patient. So I would have the patient, close one ear, right? And I'm gonna whisper something at this ear. Where are you going? And if the patient is able to, tell me, say whatever I said, then the person is able to, then I just, just to make patients hear what exactly I'm saying, whatever I whispered, and patients able to repeat the same thing to me. That means that part of the ear works. And then we're gonna do it for the right ear. Patient close the right ear, and I'll go onto the left side and also whisper something and have the patient tell me what exactly I whispered. Okay, and if that works out, so we would say the cranial nerve 8, the vestibulocochlear nerve is also intact. Okay, so we're gonna go to the cranial nerve 9, which is the glossopharyngeal. This is the check for patient's gag reflex. So in this case, I would have, I have the patient open his mouth, and I could use a a tongue depressor, and I'm just gonna go in there and just stick it just at the back of the pharynx, the posterior pharynx, just to initiate a gag reflex. And if I notice that gag reflex, then I should know that yes, the patient is able to produce that, which is which is actually really good. And then I could also ask the patient, to say ah, and then I'll take a look at the uvula, make sure the uvula is able to move up, and that will also be a very good sign. Okay, and then we're gonna go to the cranial nerve 10. This is just to check for patient's ability to swallow. So in this case, patient is talking, patient is able to swallow. So in no signs of hoarseness while the patient's talking, able to swallow. So that's cranial nerve, the vagus nerve, which is the cranial nerve 10 intact. So we're gonna also check the cranial nerve 11, which is the accessory muscle. So in this case, I'm gonna have the patient, move head from side to side. And I noticed without any patient isn't having any, didn't having any issues. So which is good. I'd also have the patient move his head up and down, without there's no resistance or no form of discomfort. That would be a good sign. Also have the patient shrug shoulders, apply pressure on the shoulder and have the patient shrug the shoulder. The patient is able to shrug, without any issues, without discomfort or resistance. Apart from resistance I applied, this cranial nerve is actually intact. And then lastly, we're going to assess the intracranial muscle, so intracranial nerve 12, which is the hypoglossal nerve. So this is where you can ask the patient, stick out your tongue, and he sticks out his tongue, and then I ask the patient, move it from side to side, and the patient is able to, so which is which indicates that's a good sign, and the patient's cranial nerve hypoglossal is actually intact. And this comes to the end of this aspect of the assessment. Thank you.